PatientChase is a desktop application used to manage patient recall in a practice, handling the QOF, health checks, flu recall, and identifying NHS numbers from secondary care provider lists. It automates and simplifies all manual tasks and makes recall as straightforward and easy as possible. It identifies any combination of patients that you wish, enables you to correspond with those patients via several methods such as mail merge, SMS, email, and prescription labels via QOF alert messages, and it records all the communication you make with patients into the patient's notes and into its log system, thereby giving you a full audit trail of all the communication you make with patients. This enables you to then run a report and identify patients who've had 3 or more for exception reporting purposes. When you first install PatientChase, or whenever you use PatientChase, you need to make sure the data is up to date. So by clicking the EMIS sync button, this will synchronize with EMIS and put in the very latest data that you have on the QOF, which registers patients are on, which QOF targets are outstanding, and so forth. So we'll start by building a QOF search for a bespoke list of patients. So by clicking the Add button, this loads up what we call our search builder. This is the search builder. And by selecting the Not in Target search, this loads up the registers, as you can see. And the numbers represented there show you how many people are on within each register. To the right-hand side, as you can see, I'm moving, the targets appear for each of the different conditions. So for example, over stroke, to the right hand side, you will notice that there are patients who have got outstanding stroke targets, and the numbers in brackets show you how many people you need to recall. Now we can select any combination whatsoever. You can select individual targets by moving to the right and selecting individual targets, or you can select entire conditions and merge them together. So I'm just going to select a few conditions. And what it's doing now is it's totaling up the numbers of patients who appear on one or more of those registers. So it's already, some clever algorithms have already identified that there are 420 patients in this group that I've selected. We're just building an umbrella of patients. So 420 patients in this group who have got targets in one or more conditions. Some patients may just have 1 or 2 stroke targets, some may have also some heart failure targets, others may be diabetic too, and so forth. It's a real mix of patients. What we're doing now though is we are grouping the patients together. So what we're going to do is we're going to have a look at who these people are. So by clicking Finish Search, we load up the list of patients. And here is the list of patients. So as I click on the different names, the different details appear for the patients. It's putting the most complex at the top. So these are comorbidity patients. Notice all of these patients have different conditions. And they have multiple conditions. The idea being when you recall the patients, the letters will indicate that they have several conditions and they would get recalled once as opposed to several times throughout the year because they have several different conditions. This makes it far more efficient for the practice, fewer clinic slots, and far more convenient for the patient. Now that you've produced your list of patients, you can move on to the next stage. From here, it's very easy to filter the list. For example, remove housebounds. Run an export from EMIS of your housebounds, so a quick search showing your patient numbers, export it to Excel, and then once you've done that, you can select patients from Excel export, click open, find your list of housebounds, click open, and it will highlight them for you. Everyone in blue is a housebound, so you can see. So you can, with one click, group, delete those patients. So your list has now removed all the housebounds. You can further filter the list by any set of criteria, such as recently deceased patients, nursing home patients, patients associated with a particular doctor, usual registered doctor, patients with a branch site, Now, once you've tidied up your list, you're ready to move on to the next stage, which is producing an Excel spreadsheet, should you so wish. You can go straight to mail merging, but I'll show you firstly how to produce a list into Excel. Right click, export search to Excel, and Excel opens up. If we scroll across, here is a comorbidity spreadsheet showing you each row is a patient, showing you which conditions that patient has. Very difficult to do without PatientChase, very easy to do with. You may wish to print this list off, hand it to a receptionist and get them to do a phone round. Sometimes it's more appropriate to do a cough recall by telephone. Alternatively, you could hand the list to clinicians and they could strike through those patients they don't want letters being sent to. And you can come back to PatientChase, select who those people are, right click, remove them from the search. Once you've got a list that you're ready to mail merge for, right click, export to letter. That's going to basically do a mail merge. You can, and most people do at this stage, when they're recording the letters, select this option, export to letter and insert into EMIS. That basically means do a mail merge and record the letter into the patient's notes. We're just going to do a mail merge for now. So by clicking this option, it says, right, how many letters do you wish to do? Quite often your search results may be more than 300 letters. You may not wish to send all of them in one go. Here is the option to batch send. So I'm just going to do 5 letters, which basically entails doing the first 5 patients, 1 through to 5. Click OK. And now it says, what style of letter do you wish to send? This is where you select your letter template, the style of wording that's going to appear on each of the letters. We provide you with a list of templates, but obviously you need to customize them yourself. Very straightforward to do. And that will be put in your practice letterhead, put your signature. I will come on to that in a moment. I'm just going to select this generic template here, which is a please come in for appointment letter. So select the style of template, click OK. And now basically Word is going to open up in a moment. Had we've asked it to insert into EMIS, it would be doing a mail merge and recording into the patient's notes that they've had a letter sent to them. So Word has opened up, and notice here is a mail merge. So I'm just scrolling through the letters slowly. We've done a mail merge of 5 letters. Each letter is completely unique to the patient and only lists the conditions and targets that apply to the patient. This is one merge field, and this identifies which conditions the patient has. This is another merge field, this block of text, and identifies why that patient's been invited in. So patient-friendly interpretations of what their cough targets are. And this is another merge field recently added to PatientChase, which identifies which blood tests the patient requires and which urine tests are required if that is applicable. So I'm scrolling further through the list, 2 conditions for that patient and this set of targets. The templates, as I said before, are completely customizable, which means that if you don't wish any of this terminology appearing and you just want it to say, our records show that it's time for your annual review, you can do that. It's very straightforward. Some practices leave this information on but remove that information, so it just tells them which conditions they have and that it's time for the annual review. Other practices do not identify which conditions the patient has, and it simply leaves this field in, simply informing them why they're being invited into the practice. It's very good for patient communication. So when the letters are received by the patient, tells them why they're being invited in, which conditions they have. Also, because the letters are stored in the patient's notes, that should the receptionist have time when the patient phones up to make an appointment, they can quickly load up the letter, notice that patient has got, perhaps, looking at this example here, 2 conditions, and think, well, perhaps they need a 20-minute slot, because they might need longer. Also, because the letters are stored again in the patient's notes, when the patient presents themselves to the clinician in the consulting room, then the practitioner can ignore all of the cough alerts, quickly load that letter and say, all right, my administrator invited me in, has invited this patient in for me to focus on these particular conditions. But like I said, it's entirely up to you how much information you provide on the letter. Touched on the letters, the templates are completely customizable, very straightforward to do as well. We'll select the template we used before as an example. So here are the merge fields, and here is the letter. So you simply put your signature in there, change your wording as you see fit. Copy and paste your practice letterhead in there. Remove any merge fields you don't wish to include. So for example, this is one merge field here. So if we remove that, that information will no longer appear. And if we remove the text field, this information will no longer appear. So you can see the templates are easily customizable. There is also a pre-built search that you can run. So I showed you earlier how to design a search based on a select group of conditions and targets. This pre-built search here, called the threshold search, is a mop-up search, if you like, of all the patients that can still get your QOF points from any stage of the year. And it will run, so it just asks a couple of preliminary questions. It will run a list of everybody that still needs to be seen between today and the end of the QOF year. Very useful to run in the last quarter of the financial year. And it's called a threshold search. So it doesn't include patients in targets where your practice has already achieved the threshold target. So I'm just going to load that search up. And the neat thing about this is, as well as sweeping the board of all the domains, you can see those at the top, the headings. It prioritizes the patients by complexity. So it puts the most complex patients at the top. So these are very complex comorbidity patients. So as I run down through the list, you will eventually find patients who've just got individual targets. You can see that there. And further down, it's a lot of smoking patients. So by running a threshold search, you can focus on the top 10%, for example. The top, let's have a look, the top 300 patients. You can send letters out to those 300 patients in the same manner that you did before, by right-clicking and exporting to letter. And by recalling the top complex patients, you're amassing a great deal of QOF points in the fewest clinic slots. So there's never a panic come March time, because you're always on top of the QOF. If you're managing your most complex patients, you're only picking up bits and pieces towards the end of the year, so there's no mass rush. Until now focused on recalling patients by the QOF, either by threshold search, which is a pre-built search, or selecting patients who have outstanding targets based on a look-ahead and population manager. Of course, there are many practices who prefer to do their recall by month of birth. Very straightforward also with PatientChase. Click the Add button to build a search. Instead of selecting the non-target search, this time we select a register search. And notice the numbers of patients on each of the registers. What I'm going to do is I'm going to filter it by month of birth. So we're going to select January. And this time the numbers have filtered to show patients on those registers all born in January. So here we select which registers we wish to focus on for our month of birth recall. You can select all of them, or one or two, or whatever selection you like. I'm just going to pick a few. And this has identified there are 74 patients, all born in January, who are on one or more of those registers. I'm going to give the search a name, just going to call it month of birth. And let's have a quick look at who these patients are. So again, prioritize the list by most complex at the top, 74 patients. You will notice as I scroll across, all of them are born in January. And it shows you which registers those patients are on. Now, one of the drawbacks of just doing a month of birth recall is, let's say I'm born in December, I'm born in January rather, and I popped in December for a clinic opportunistically. I had all my targets checked, and now the administrator's doing a month of birth recall for January. There is no need to call me in because I've had all my targets checked. So what you need to do is you need to filter this list and remove those patients who have no QOF targets. So do a January recall, but only for those patients born in January who also have QOF targets. This is very easy to do. By dragging and dropping the QOF search, this threshold search, into the month of birth search, what we've done is we've identified in our month of birth search for January, notice all born in January, but we've also filtered the list and identified those patients who also have outstanding QOF targets, and they are highlighted in blue. So those people in white, as you can see through the list, white and peach, or non-blue basically, those patients, although born in January, have no QOF targets, so they do not need to be seen. So you need to remove those patients. And by clicking delete selected patients from search, you remove those patients. So you end up with a very specific search. Everybody born in January and everybody has QOF targets. So you know that you are filling up your clinics with patients who need to be seen. We have looked at creating a mail merge for a search. Now, mail merge is just one option of contacting patients. By right clicking, this is letter mail merge, you can select any option. You can contact them by text or by email, or record the contacts that you make by telephone. Remember that every communication you make with patients is recorded into the patient's notes. So PatientChase, depending on what type of search you have, whether it's a letter, label, text, email, telephone, will record that contact in the notes as that form of contact. So when you accept your report, you can filter saying, show me all the people I've contacted by letter, label, telephone, text, email, and telephone. By converting the search to a text, you now have different options, and those enable you, by selecting this will enable you to send a text to the patients who have mobile numbers. PatientChase will automatically ask you to log into NHS Mail and will use your NHS Mail account to send out free text messages to those patients, inviting them in for their annual review. If you convert the search to an email, it will send emails, again via NHS Mail, which will be free. By converting the search to a label, you can then contact patients via the prescription. So as the receptionist is printing off their repeats in the patient's notes, should that patient have matched the criteria in the search, i.e. they appear in your search, then a pop-up box will appear highlighting who the patient is and what targets they have, and when you click print label, a label will appear looking a bit like this. Which will state, Dear Joe Blogs, our reference 1234, please contact surgery as you are due review of your asthma or diabetes or whatever the search criteria are you're focusing on. So as the receptionist is going through her normal routine of printing off the repeats, PatientChase will automatically identify which QOF alert labels need to be printed off for those patients and what information should be provided on those labels. So at the end of the prescription printing run, there is a series of labels and you use a label printer. You marry up the labels onto the prescriptions and the patient comes in and it highlights to that patient that they need to make an appointment for the following. Label printing is a fantastic feature for targeting patients for campaigns such as flu, smoking status, blood pressure, cholesterol checks, and so forth. It's supplementary to letters, so some practices send letters out but also do recall using the QOF alert labels. Other practices do it exclusively using labels. The benefit of this is cost effective, lack of postage, and it's cheap to run a label. The beauty of label printing and targeting patients via QOF alert labels is that there's a very high correlation between the QOF and having a repeat. Once you've been making contact with patients over the QOF year and recording that information into the patient's notes, then you can start running reporting and identify, for example, those patients who've had 3 or more letters sent to them. By going into the EMIS Inserts reporting tool, select the date criteria. So we'll go back to the 1st of April. And we can leave it today's date. and then you can ask it to identify the different methods of contact that you've made with the patients, whether it's by letter, label, text, email, or telephone. And then should you wish to filter the list, you can then say, I only want to see those people who have been contacted 3 or more times. By selecting that and clicking on the submit button, Excel will open up and produce a list for you of all those patients who've had 3 or more contacts made, and you then can decide what to do with that list, whether it's send them a final notice, phone them up, or exception report them straight away. The list will identify for you exactly which patients have been contacted 3 times and for which conditions. Unfortunately, during this demo I cannot show you because we have not a live connection to EMIS, but the list will granulate it to the level of which condition has been sent a letter 3 times. A couple of extra features to show you on top of the QoF recall we've been focusing on. Firstly is NHS health checks, and I'll follow that up with NHS number importing. Okay, so NHS health checks. PatientChase can handle NHS health checks very easily. By clicking on add, we select all the patients registered in practice and then filter the list by those patients aged 40 to 74, which is the age criteria for health check recall. Now we're also going to include the exclusion conditions, and those exclusion conditions are stroke, CHD, diabetes, and kidney disease. So I'm just going to call this search health checks, and let's have a look at this list of patients. So here is the list, the 1800 patients, all of whom are aged 40 to 74. What I'm going to do now is I'm going to sort the list by the condition column, and what this does is it shows me all the patients who are registered in practice aged 40 to 74, and it's sorted in the order of those patients who are on one of those exclusion criteria, those exclusion conditions. So now if I select all the patients who don't need to be seen, i.e. who have those conditions, just running through the list. Now if I select all those patients who do have those conditions, right click and delete them from the search, we end up with a list of patients all aged 40 to 74 who do not have any of those conditions, i.e. this is your target group for recalling for health checks. You can then go about the usual way of sending those patients letters. And of course PatientChase will record and audit that information just as it does with your QoF letters. Moving on to NHS numbers. Quite often practices are provided with Excel spreadsheets which just list NHS numbers of patients with recent activity at that secondary care provider. For example, recently discharged patients, high value patients, those patients who are frequent flyers, 3 or more attendees at A&E. It's often the task of an administrator to then work out who these patients are. With PatientChase, you can do that very quickly by building a search of all your patients. So I'm going to call it the registered population. We can then import that Excel spreadsheet into PatientChase of NHS numbers. Select patients from Excel or use export. Find that NHS number list that's been provided by the hospital. Click open, and it will highlight the patients who match the list. So everyone in blue matches the criteria of being a patient in the practice. So it will highlight who is actually in the list. So we'll find someone in blue. There we go. So it then provides you with that information which you then can record into EMIS. It saves you having to go through each NHS number and into running an individual search in EMIS to find out whether they are patients of the practice, and if so, who they are. It will automatically do it for you. It will also produce a list for you in Excel of those patients who do not belong to your practice. So if there are any patients with NHS numbers that are not registered in your practice, it will provide you with that list as well.